Chapter 5, Behavior Reduction. Module 1, Common Functions of Behavior. Identifying behaviors. Everything we do is considered a behavior. Eating, drinking, walking, sleeping, these are all behaviors. All behavior occurs in social contexts. Behavior occurs because it serves a purpose for the individual, providing the quickest route to reinforcement. Unfortunately, sometimes the easiest, most direct route to reinforcement may be through problem behavior. Before we describe reducing behaviors, let's look what increased inappropriate behavior in the first place. Consequences, reinforcement, and punishment. Reinforcement. Reinforcement is a process which results in an increase of the future probability of a behavior. Positive reinforcement and negative reinforcement. Positive reinforcement. The presentation of a stimulus that results in an increase in the probability of a response. So we're presenting something to increase the likelihood of behavior. Negative reinforcement. The removal of a stimulus that results in an increase in the probability of a response. So we're removing something that is aversive, which increases the probability of behavior. Defining inappropriate behaviors. Any response can be considered inappropriate for different reasons. Is it stigmatizing? Does it interfere with learning? Is there injury to self and/or others? What is behavior reduction? Decreasing maladaptive behaviors. What is a maladaptive behavior? Maladaptive behaviors are types of behaviors that inhibit a person's ability to adjust to situations. Increasing adaptive behaviors is the key. Since behavior often represents communication, it is essential to replace behavior by building more adaptive skills. It is important that you and your team not assume that a child has the skills needed to do something the right way, and that you are prepared to use systematic instruction and motivation to build new abilities. Form versus function. Form is what the behavior looks like. A behavior with the same form may have different functions. A behavior with many forms can also serve the same function. Functions of behavior answer the question, why? What's inappropriate about inappropriate behavior? Specify the behavior you want to change. Dimensions of a response help us specify the behavior. Any which of these can be considered inappropriate. Topography. This refers to the form of a response. Example, what a response looks like. Frequency refers to how often the response occurs. Intensity refers to the magnitude of a response or how strong the response is. Duration refers to how long a response lasts. Why do we see problem behaviors? These could be at school, home, or anywhere. We see problem behaviors because they are functional. Children engage in challenging behavior because it works for them. It pays off. It serves a purpose. They get results from their problem behaviors. For example, gaining access to something or someone, or avoiding something or someone. What else do we know about problem behavior? It is most often a form of communication, although inappropriate communication. It's a child's attempt to communicate what they want, what they don't want, or what they need. It is related to the broader context in which it occurs. The bottom line, it interferes with learning and negatively impacts the quality of life. Function. Here is a quote from Dr. Ted Carr from the State University of New York at Stony Brook. Communication-based interventions refer to an approach that reduces or eliminates problem behavior by teaching an individual specific forms of communication. Because the communication forms that are taught are more effective ways of influencing others than the problem behavior, they eventually replace the problem behavior itself. By communication training, we mean that individuals are taught specific language forms, including, for example, speech, signing, and gestures that can be used to influence other people in order to achieve important goals. What are the alternatives? If problem behavior is functional, it meets some need for the client. We cannot simply remove behavior that is serving a purpose. We must replace the behavior with a more appropriate alternative. The first step is to understand the function it serves. What need does it meet? We have to offer the client a better way to meet that need. We cannot do this until we know why he or she is showing us quote-unquote bad behavior. Assessing the behavior. First, we have to find out its function. Why is the behavior occurring? What reinforcement has been maintaining the behavior or causing the behavior to increase? Obtaining something you want or avoiding something you don't want? What appropriate behaviors may replace the inappropriate behavior? Let's look at the functions of behavior. First, we will look at escape or avoidance. Behavior results in escaping from or avoiding undesirable activities, people, settings, or events. This includes avoiding anxiety, pain, or discomfort. Attention. The behavior results in obtaining attention from others. This includes both praise and criticism. Functions of behavior continued. Tangible. Another reason behavior occurs is because it results in acquiring a desired object or activity. Sensory or automatic reinforcement. Behavior's primary purpose is to meet a sensory need. Self-stimulatory behaviors are included in this, which are intrinsically motivated. Behaviors occur anytime, anywhere. In fact, the client has access to this self-stimulatory behavior 24 hours a day. May occur more often under stress. Before a behavior reduction program can be implemented, we must first rule out a medical reason for the behavior. Determining the function. How do we determine function? Through direct observation, in which we use different assessments, for example, ABC or sequence assessment charts, scatter plot assessments, and interval data. There's also indirect measures, which are interviews such as the FAST, the Functional Assessment Screening Tool, or the MAS, the Motivation Assessment Scale, or other ecological event type of interviews. We want to gather as much information about contexts and consequences as we can. Why is the behavior occurring? Again, we use a functional assessment. A functional assessment is a description of the environmental events that precede the occurrence of the targeted response, a description of the response itself, and a description of the environmental events that occur as a result of the response. Behaviors may occur for more than one of these four functions. ABC or sequence assessments. ABC are antecedent, behavior, consequence. Antecedent is what happens directly before the behavior occurs. Behavior is the targeted response, which will be operationally defined by your supervisor. Consequences are what happens directly after the behavior occurs. Antecedents, events that precede the behavior of interest. Remember, antecedents set the occasion for behavior to occur. They trigger behavior. When identifying the antecedents, consider these questions. Where does the behavior happen? With whom does the behavior happen? When does the behavior happen? What activity is the behavior occurring during? What are other students or people doing when the behavior begins? What are other teachers and adults doing when the behavior begins? Behavior or response. The client's behavior or response following the antecedent. Even though you should have a clear, operationally defined target behavior with examples and non-examples, it is important to record as much information about the behavior of concern during your observations. Rather than writing aggressed, your notes may be enhanced by more detail, such as kicked peer, hit teacher with fist, punched peer, or pinched peer's arm, for example. Consequences. What happens directly after the client's behavior or response? What events will follow the behavior of concern? What happens following a behavior influences the probability of the behavior. If a behavior increases in probability under certain environmental conditions and following certain consequences, then those consequences are called reinforcers. Consequences continued. We try to find the consequences that maintain a behavior or reduce the likelihood of a behavior. This interaction between behavior and consequences is called a functional relationship. These contextual events will reliably occur either just before the behavior or just after the behavior.